is Nancy, and I'm the host for today, and I met Richard before class, so I've got some information that he shared with me, that I'm gonna give you a little intro to him. He is an MD, as you can see from his slide up there, and he has lots of other things too, that he can tell you about if he wants to. I think you're an internist, is that what you said? Okay. He is currently co-director of Global Health Leadership and Administration Program at the School of Public Health, University of Haifa in Israel. And he is president of a consortium, Southeast Hypertension Control. It's an international group dedicated to reducing cardiovascular death and illness due to disparity in populations and improving management of risk factors for cardiovascular events. So I think he tries to keep people as healthy as they possibly can. That's
right.
what I take from that. That's
Sounds
my
good.
summary.
Right.
And he probably wondered why he flew over from Israel for the day. I was wondering the same.
Because I get paid so much.
Yeah, because they, you know, that certificate to take a class that he's going to get at the end was very enticing. But he's a former professor at UGA and founding director of the Center for Global Health at the university, and he is here some months and in Israel some months of each year, and there is a whole lot more that he can tell you and that he's done, but if that's good enough for
That's
you,
great.
it's a kind of a highlights
Right. That's excellent.
piece, and thank you for coming, we
Good,
appreciate
thanks,
it.
thanks. I have a cousin who's a professor at the University of Michigan in the medical school, and he said one of his life goals was to have more letters after his name than in his name, and I'm pretty close now. So I'm kind of in competition with him, so I feel pretty good about that. Thank you all for coming, and what I'm hoping is that this will be an interactive discussion, okay? I really, as I was saying to Russ, I really don't want this to be a lecture per se. I'm going to try to give you plenty of information, but I'd really like to hear from you as well, particularly if you don't understand something. You're welcome to disagree with me. My wife does all the time, and so do many other people, so you're welcome to. As we proceed, we're actually going to have a discussion, and at the end, we're going to openly discuss where we think the U.S. healthcare system is going to be, and we'll actually take a vote, okay? So, and then, before we go any further, are there any either current or former philosophy professors among you? No, I'm really, okay, because I'm gonna take on philosophy a little bit, and if somebody really knew what I was saying, they might disagree with me. How about political science professors or history professors? No, okay, yeah, all right, what?
Just, well, dual moment, but high school, college, and U.S. history.
Okay, fair enough. Well, if I do something wrong, you can throw
Hey,
something.
I'm not using it, I'm losing it.
And how many of you have heard me before? Just a few. Okay, fine. This is, I think, the third or fourth time I've spoken at Ali. I tried to have it consistent with the previous discussions, but not the same. Okay, so that if you've heard me before, you won't fall asleep, and if you haven't heard me before, there's something to learn. Okay, so hopefully we'll be okay with this. All right, what we're going to do today is we're going to talk about healthcare systems, and we're going to talk about healthcare systems around the world by actually looking at a few examples that I think are good examples. And then it's impossible to be a citizen of the United States and not have to talk about the U.S. healthcare system. So we're going to talk about it a little bit. What got me interested in global health was really this issue of looking at the U.S. healthcare system and trying to figure out how we could make it a better healthcare system, okay? And looking for what today we call best practices. And I don't have on the list the Israeli healthcare system today, although that's where I'm now teaching. but we can talk about that too if people want to hear about it. I just decided to talk about a few other ones. Okay. So first of all, as I started developing my own interests in global health systems, I learned that healthcare is in a crisis, right? I think everybody would agree with that. You look at the newspaper yesterday, today, tomorrow, there's going to be some big article on healthcare costs. Healthcare is always in a crisis. And as I started studying this professionally, I started going back to the 1980s, the 70s, the 60s, the 1950s, 1890s. It doesn't matter. Healthcare has always been in a crisis, okay? And so, as I say, for me it's good because I got good job security. I can always prognosticate and try to figure out how to make it less of a crisis. And I won't really solve anything, but if they keep paying me, that's good enough, okay? All right. So, let's start by just deciding what are the characteristics of an ideal healthcare system, okay? And let's see what we can do. What do you need in a healthcare system to work? I promise I'm not going to pick on these two unless they volunteer up here. And Carol?
Accessibility.
Accessibility, okay? And so what do you mean by accessibility?
That everybody should have the option of using it if they want to.
Right, okay, so there are really two things. Everyone, so you're talking about universal availability, and then you have to be able to get to it, okay? So here in Athens, Georgia, we have two hospitals. Pretty easy to get to one or the other of the hospitals, okay? If you live in the southern parts of Georgia, there are sort of hospitals, although some people would contest that they're not particularly good. If you live in northern Canada or the outback in Australia or on one of the islands of Greece, accessibility is really tough, maybe impossible. Okay, so good. What else? Yes, ma'am.
I think the emphasis on preventative medicine.
Right. Okay. There's a lot of evidence today that prevention saves money, and obviously, if you can prevent disease, you yourself and your loved ones will live longer and be healthier. There's a lot to invest, and we in the United States do a mediocre job at that, and other countries do a better job. We'll talk about that a little bit. Yes, sir.
Allocation of resources necessary to deal economically with the risks and benefits according to the severity of the illnesses and the necessity of those procedures required to improve or ameliorate those conditions.
Great. When I'm teaching my students, I say to them, if I ask you a question and you don't know the answer, just say it's about the money, and you'll almost always be right. Okay? At least with my questions, okay? And to put it simply, it's about the money. It is what you pay for and what you get. And I'm going to translate that into value. Okay? So it's more complicated than money. It's what you pay for and what you get. Yes, sir.
Supply and demand.
Okay, what do you mean by that?
Well, there has to be a balance between availability and demand for it.
So one of the big issues in healthcare everywhere in the world is that the demand is almost infinite. Okay? People want virtually an infinite amount of healthcare. Just as a very simple example, I practiced clinical medicine as a clinical doctor. You go to the doctor kind of doctor for 15 years in Rochester, New York. We moved to Dayton, Ohio, actually for my wife's career, and I was still seeing patients, but I was no longer financially dependent on it. So I could be very relaxed with how much time I spent with my patients because there was no financial impact for me. And I discovered that people would really take an hour of my time with a cough or a cold or something pretty minor if I didn't go running quickly out the door. So the demand for healthcare is, and that's just one very simple example, okay? But it's a real challenge. And how do you supply the right kind of healthcare? Okay? So just one second. So what I tell people, actually, in Israel, people get the healthcare they need, not the healthcare they want. And we'll look at that with some of the other countries today. Bob?
Yeah, social versus individual value, and by that I mean how it affects the rest of the community that you get healthcare, good healthcare, such as vaccinations and that kind of thing.
Right, this is a huge issue in public health, and it's an ethical issue. When do you make people get health care, and when do you try to induce them to get health care? Okay. What's that? There are, I think were these Nobel Prize winners from the University of Chicago, I think so, who wrote the book Nudge, okay? And they talk about how to change behavior without obligating people. But if you look at the measles epidemic in the United States, for example, this past year, people were refusing to get their kids vaccinated. And New York particularly has a problem, and there's something in the paper a week or two ago. When do you force people? Well, you can force children. That's what the law says. You can't force adults. Yes, sir?
I'm not saying you should cater to every whim or every little pain, but compassion should be integral to the system.
Yeah, I think that's true. I don't have it on my list, but it's a good one to answer, and not one that is paid much attention to in the medical care system. It's an issue that my wife was the dean of the medical school here. It's something she put a pretty big emphasis on for medical students, because compassion can get lost very, very quickly. And quality. Okay.
Quality care.
Right. So what you want is well, let's just do it here. Okay. You want everyone covered. Okay. Well, at least I do. Okay. And most people say they do. Okay. It is not a universal statement. There are some people who would argue with that, but I think most of us say that everyone should be covered. That's equity. And everyone should be treated fairly and equally. That's equality. The two are not quite the same. Okay? You want the health care to be effective, right? That's the quality piece. In other words, you want to get what you need. If you need a CAT scan, get a CAT scan, don't get an MRI. If you need an MRI, get an MRI, don't get a CAT scan. Do you need both? Maybe, maybe not. Okay? And that then falls into the efficiency issue. You want to be able to get efficient care, and that then becomes a dollar thing. It's a cost issue. Okay? So to me, this is a pretty simple, and we could come up with a list that was longer, and compassionate care, I think maybe I should put on that list. Okay, so thank you. But this kind of covers it, and as we proceed looking at healthcare, let's remember these, okay? Okay, so now we're going to do a little history. This is where we get into the philosophy and political science, and let's see where it takes us, okay? And we're going to start not by talking about light bulbs, but by talking about enlightenment. Now, you can make the argument that healthcare, modern healthcare really didn't get very far until the 20th century. In fact, not really until pretty much the middle of the 20th century, when antibiotics became available and modern surgery and so forth. But you can drift back into the 19th century and even the 18th century, where we're going to go here for a little while. So, the Enlightenment was a really important time in the history of the world. You have people like Rene Descartes and John Locke, and I am not a philosopher, and I don't want to go too much further. I chose to get this quote from the Britannica online instead of Wikipedia so that I wouldn't be laughed at, okay? But it's probably just as good. Central to Enlightenment thought were the use and celebration of reason in contradistinction to things like religion. Okay, so this was an attack on religion, which certainly has been very dominant for a very long time, but started losing some of its control over people at the time of the Enlightenment. The power by which humans understand the universe and improve their own condition. The goals of rational humanity were considered to be knowledge, freedom, and happiness. Okay? And so the key things here are reason becomes important, rationality becomes important, individual knowledge, personal freedom, happiness. These are words that we kind of take for granted, but in fact, they began with the Enlightenment. And what's so important about the Enlightenment as it relates to U.S. history? Anybody?
Jefferson was a student of John Locke.
Jefferson was a student of John Locke. Okay? And the whole creation of the American culture, American society, American government occurred at the time of the Enlightenment. And many of our founding fathers, including Thomas Jefferson and John Adams, were very strong proponents of the Enlightenment. They were influenced very substantially by it. As it turns out, as you can see from my picture here, these two guys didn't get along particularly well. They actually did and didn't, okay? This boxing glove thing is going to drive you nuts. It does for me, so I decided we'll just keep this picture up and take the boxing gloves down. What did they disagree about? Anybody know? First of all, John Adams was the second president of the United States, and Thomas Jefferson was the third president of the United States, okay? They were both politicians, although I think Jefferson was more of an effective politician, okay? John Adams and Jefferson actually worked together in Europe during the war, trying to get some treaties, trying to get money from the Europeans. And they got along for quite a while. And then they started having differences of philosophical opinions and personal issues. So Adams is the second president of the United States, that's fine, but he didn't serve a second term. And he was very bitter about that because he got pushed out by Thomas Jefferson, okay? Now, they didn't get along for the longest time, and this sort of finished this little piece of the story. They ultimately did start getting along again. Apparently, Dr. Benjamin Rush brought them together. At least he claimed that he did. And as old men, they started writing back and forth to each other. They both lived until the 50th anniversary of the Declaration of Independence and died on July 4th. Both of them, same day within hours of each other, 50 years after the signing. Okay, interesting. Okay, now that's fine, that's cute, but why are we talking about this as it relates to healthcare? Well, we're going to get there in a moment, okay? So here they are, they're happy now, okay? And we're going to start by talking a little bit about the beliefs of Jefferson, who was a disciple of John Locke and of Jean-Jacques Rousseau, who believed that people should be able to run around in the woods naked and be natural, and that that's the way life should be, okay? And he actually talked about the noble savage, okay, as the ideal model person in the world, okay? They could just run around, and to him, to Rousseau, to him, these noble savages, which we would call Native Americans, okay, were just the ideal person. He didn't really understand, I don't think, a whole lot about what their life was like. But this idea of running around naked in the woods was attractive to Jefferson because it promotes individual freedom. And he was big on individual freedom. Okay? Let me do what I want. Life, liberty, and the pursuit of happiness are his words. Right? Okay. Adams, on the other hand, believed that government decides what's good for you. Vaccines, okay, will be an example. We'll get back to that again in a minute, okay? So Adams said, we need a strong central government, just like the British. Now, it turns out this didn't go over too well with Jefferson and his colleagues, okay? Because they were very worried that what Adams wanted to do was to recreate a monarchy, either rejoin Great Britain or to crown George Washington King of the United States, okay? So Adams had a very different philosophy, and when you translate this then into simplest terms, Jefferson believed in a weak central government and Adams believed in a strong central government. Okay? And the parties, Adams was head of the Federalist Party, and Jefferson, I've read some places they call them Republicans, they call them Democrat Republicans. Today, I think we would call this more of the modern Republican Party would be adopting more of his beliefs, okay? Now, we're here to talk about health systems. What would the health system look like with these two different philosophies? Because ultimately, it is these political philosophies that drive the creation and the maintenance of health systems, whether it's in the United States or in other countries. We're going to talk about the U.S. here for a moment, okay, but let's think about it. So if Jefferson created a health system, and needless to say, in the 18th century, there was no health system, and actually in the 19th century, there was no health system. But if they were, Jefferson would not want a system. He would say everyone should decide for themselves. Right? If you want something, you should be able to get it yourself. A basic belief that is an American foundational belief, beginning, however, with the Enlightenment philosophers who were not particularly American, okay? But we adopted a lot of this stuff, okay? And if Jefferson were creating a health system, there wouldn't be universal coverage, because he would say, everybody decides. It's your freedom, it's your right not to have health care if that's what you choose. Think about it. Okay? And for sure, you would not have the government paying for your health care. Right? When the United States was created, the federal government had no ability to tax. Didn't pay for anything. Okay? It was a big problem. Right? Okay, John Adams would have been more likely to create a single system. It would have been run by the federal government. Everyone would probably be covered. It would be paid for by the government. Today, Alexander Hamilton is pretty popular because of the musical, and Hamilton was also a Federalist, okay? So he was more in the Adams camp. And probably George Washington was. He tried to stay very neutral, but his beliefs were more toward the Federalists, okay? So you look at that, and you see the beginnings of how you would create a health system in this country, and how challenging it's been 200 years later, because you have these opposing, very deep political and philosophical beliefs that have to be somehow accommodated by a population that has all these different beliefs. Okay? So I'm just curious, let's just have a show of hands. How many of you would call yourselves Federalists? Okay, and how many would call yourselves Democrat Republicans? Anybody? Yeah, okay. All right. This is the heritage that we all have inherited, whether we know it or not. Okay? All right. Okay, now we're going to advance to the end of the 19th century. So these guys were fussing around, Jefferson and Adams, at the beginning of the 19th century, the early 1800s, right? The Constitution gets signed, what is it, 1784 or something like that. And so just as you turn into the 19th century, you have Jefferson as president and so forth, okay? We're going to advance more toward the middle of the 19th century now, and we're going to talk about the creation of a social welfare system in Europe. Anybody know who the guy in the middle is?
Otto Bismarck.
Bismarck. And who is the guy on the right at the bottom? That's Kaiser Wilhelm. Okay, and who's this on the left?
Karl Marx.
Karl Marx. I tell my students this is Karl Marx. He was one of the Marx brothers.
After Domo.
And they all stare at me because if you're 25 years old, you've never heard of the Marx brothers, which is good. And I could put up a picture of Groucho and all the other Harpo and all these guys with Karl, but it wouldn't be worth the time to do that. Okay, times have passed. Okay, So, what do you think the political philosophy of Kaiser Wilhelm was? He's the Kaiser of what today we call Germany, okay? Liberal, conservative, what do you think? Monarch. What's he gonna be?
Conservative.
Conservative, sure, sure. He's interested in maintaining himself and having his descendants remain rulers of the country. This is not a liberal guy, okay? What about Bismarck? Anybody know what his social philosophy, political philosophy was?
Bismarck started the first total coverage plan, didn't he?
He did. And was that because of his social beliefs? No.
I don't know.
He was working for the boss, who was a right-winger from way back, okay? He'd probably make Donald Trump blush, okay?
Maybe
And
healthy people make better
Or would.
soldiers. Healthy people make a better, stronger country,
okay,
perhaps.
that's part of it. That's part of it, okay? Bismarck was a great politician. He was one of the world's greatest politicians. He was very good at figuring out what was happening. And in the middle of the 19th century, in the 1800s, what was Karl Marx talking about? What was going on?
Socialism.
Socialism, actually communism,
Yeah.
okay, right? And frankly, it scared the hell out of these guys, okay? All right? So, 19th century Germany. Two pictures. Which one describes 19th century Germany? What do you think?
Both of them in one sense,
Man with a hoe.
but moving towards.
Right. So there were plenty of people who were rural, like this, and we're going to talk about the man with the hoe in a minute. But this is what was going on in Germany. It was the Industrial Revolution. People were being drawn to the cities, okay? And when Karl Marx wrote his Communist Manifesto, he was talking about this kind of environment. He wanted the workers to overthrow the owners, right? And that was the whole deal with, I mean, communism is much more complex, but that was sort of the essence of it. And Bismarck understood that. They were threatened. The monarchy was threatened. And like any good politician, what do you do when you're threatened? You give people some of what they want. You don't give them everything, but you give them enough to keep them quiet. And that's how Bismarck created the social welfare state in the 19th century in Germany, okay? Now, what happened to communism was Marx called it wrong. The Germans got enough stuff out of the industrial world. They did not want to become communists. So instead, this fellow named Lenin comes in and he gets people from the Russian rural area, the serfs. Now, they weren't technically serfs anymore, but effectively so. This is a famous picture of the man with the hoe, who is it's a picture of hopelessness. This is a man who gets up every morning, works probably 16 hours a day, is exhausted, goes to sleep, eats, goes to sleep, and gets up the next morning, and that's his entire existence, okay? And will be the existence of his children and his grandchildren. That's the man with the hoe. And that's who ended up becoming communists, the Russian serfs, okay, to make a long story short. But the story to be told is the German story and Bismarck. So what Bismarck chose to do was convince his boss, the Kaiser, that what they should do is create a social welfare state, which meant two things. One, they created a pension plan. So the first national pension plan was Germany, and they created a health insurance plan. Pension plan, you weren't eligible for your pension until you were 65 years old. How many people in the 1860s lived to 65?
Very few.
Not many. Okay, that was part of the deal, okay? So it didn't cost them too much, so they could say they had this. Whether many people got it or not, they had the opportunity to do so. And, as we will see, when it comes to healthcare,